Everybody, I'm Parm Eftekari, the co-founder and EVP of Research for the Health Tech Council. I'm joined with Kirk Nahra, a partner at Wiley Ryan and a very well-known expert on healthcare security and privacy regulations. We're at the April 2013 Health Tech Council meeting. And Kirk, I want to ask you a few questions. First of all, there's been a lot of talk lately about Omnibus and how this impacted security and privacy requirements for healthcare providers. Can you talk about what that actually did and what were the impacts of Omnibus?
Sure. The Omnibus regulation is the result of the high-tech statute from 2009, and it's essentially a series of different regulations that implement privacy and security provisions.
Okay.
There's a lot of details, but in terms of some of the most important things, it applies the privacy and security rules to business associates who are service providers. So it's very much a widening out the reach of these privacy and security rules, so that all these service providers to healthcare companies and the people who provide services downstream to those companies all have to follow these privacy and security rules, which is a big change for them.
Yep.
It also implements some requirements involving security breach notification. So if there is a security breach involving people's information, there's a process to go through, but then you have to notify the individuals if there's been a security breach involving their information.
Okay.
So that makes a lot of these, it does two things. It makes a lot of these breaches more visible to both the public and the particular affected individuals. And because nobody likes to have to report them, it hopefully makes people improve their security practices also.
Absolutely, transparency. So just practically speaking, there seems to be two groups really impacted. One is the hospitals and one are the business associates. So can you talk about, for both groups, what are the practical implications of this for them?
Sure. For hospitals, and I would lump with hospitals any kind of healthcare provider and also health insurers who are also covered by the rules. Those are the entities that have been covered by these privacy and security rules for a number of years now. What the rules do is make modifications to them, some changes. The breach notification rule, for example, applies to everybody, and that's a new provision that applies to hospitals and health insurers, and they're the ones that have the direct obligations because they're patients and they're customers.
Right.
The other changes are not huge necessarily. There's also more penalties, however, and there's more enforcement associated with the statute. So it's sort of a higher priority deal, even though the bulk of what the rules have been hasn't changed for them.
Right.
For the business associates who are the service providers, they've always had contract obligations, but no enforcement and no ability to have enforcement against them. They weren't subject to government enforcement. So now they both have to lift up what they have to do. They have to follow the security rule, they have to follow the breach notification provisions, and they're subject to enforcement to the government, subject to enforcement by the government, which they've never had before.
And you mentioned that it's the service providers and even the contractors who work with service providers.
Downstream
goes
and downstream
right?
and downstream.
All right.
As long as the information goes.
Gotcha.
Could be 10 people away from the hospital.
Okay, so how's the enforcement work, and what's going on the enforcement side of things with all this?
It's interesting. I mean, when the first rules went into effect, which has been almost a decade ago now, the position of the government was that the information flow in the healthcare industry was so important that they wanted to make sure people didn't shut down information flow. So they said, we're going to fix problems, we're going to teach people, and we're going to educate. And that meant that they weren't going to go out and hammer people. And that made a lot of sense back then. And then that continued for many years. And we really have had very little enforcement of these rules for a number of years. When the high-tech statute comes into effect, they increase the penalties, they increase the staff, increase the resources, and there's been a little more enforcement. There hasn't been a lot more enforcement, but there's a couple of different things going on that go together. There's been somewhat more enforcement, there are higher penalties. They're now doing some audits independently of particular situations, so that's another exposure. And then this breach notification also makes a lot of this, a lot of these mistakes public. So those all combine to sort of increase the risks of enforcement. And they now have the ability to have much higher penalties if they choose to go in that direction.
They're basically incentivized, right, through the regulations. They're incentivizing compliance.
Well, it gave more incentivized compliance and gave the government more opportunities if they choose to go that direction. I mean, people in the healthcare industry are very familiar with some of the fraud rules where the government hammers people on the fraud rules. It's not anywhere near that yet, but it's
getting there.
Well, it's getting somewhat closer to a point where it's not going to get that far. But
and we all saw how those fraud regulations really changed things, right? That's a whole other interview.
Well, yes.
I think lastly, for Health Tech as an organization, as you know, what we do is conduct research with executives in the healthcare industry and bring them together to collaborate as a community. Why are these forums valuable to you, and why do you get involved with the organization?
Yeah, I mean, it's such a nice mix of the practical and the technology and the policy, and these are issues that really do require all of that because we're trying to figure out what we want to accomplish with healthcare information. We're trying to figure out how to protect patients. We're trying to make sure that all the information can in fact work.
Yep.
Every time you give a patient the ability to restrict information flow, that means that information is not used for some other purpose. And we're having impacts on public health and on research and on business operations. And it's a real challenge that really requires the whole package of people in the healthcare industry to work together. Not only different kinds of companies, but also people in different positions. And it's not just lawyers, it's not just compliance people, it's not just technology people, but really need the whole package of people working.
Yeah, got to break down the silos to really move things forward.
Absolutely.
Awesome. All right, well, Kirk, it was great to have you here, and we'll see you next time.
Thank you very much.
Thank
Happy
you.
to do it.